My preceptors have shown me to do practically everything. They've really made my learning experience come to life, essentially, in the clinical setting. So everything from communicating with patients and building trust and rapport with your patients, I've learned, as well as clinical technique and how to perfect my physical exam findings and my physical exam technique.
In each place I was working one-on-one with either a nurse practitioner or a physician who really kind of mentored me and helped to encourage me as I learned about specific conditions as well as taking care of patients over the spectrum of their adult lifetime, and encouraged me to be an independent provider and really take the best possible care of patients.
What my preceptors usually tell us, I believe, is that you have to, sometimes even if it takes you walking out of the room for a few minutes, excusing yourself, gather yourself and know that whatever happens in the room, it's more than likely not about you. It's more about the patient and their situation, where they find themselves.
Another great thing that our preceptors provide for us is just being role models. Like, most of these women they're working RNs, a lot of them are mothers, that have children at home. A lot of them are going back to school and furthering their own educations right now, getting masters, getting doctorates, PhDs, and kind of just seeing that they're able to sort of juggle all these things and still come to work every day and kind of have that compassion with their patients and be excellent nurses.
We had a patient on our floor who was quite ill. She had a gastrointestinal infection that was really hard to manage. And her two daughters, adult daughters, were there, and they were clearly very concerned for their mother's welfare. And early on, they were just really involved and a little overwhelmed by everything that was going on, really questioning everything that the nurses were doing, and kind of unhappy with sort of not knowing all the answers to what was going on. And my preceptor was just so great at communicating with them and helping me get involved in that communication, enough so that I took my time to explain what I was doing to the patient's children, and over the course of a few days really gained their trust to the point where when I came back in for future shifts, they were asking me, "Are you going to be with our mom today?"
Thank you so much for taking me on as a student. We've learned so much from you. The lessons that you've taught us have been invaluable, and for that we're forever grateful. And because of you, we're going to be great practitioners in the future.
Thank you for investing the time in each of us and in the development of our careers and the development of each of us as independent providers.
Thank you for your patience, and thank you for being so kind and generous in giving me what I need to become a confident and skilled nurse, and eventually nurse practitioner.
Thank you so much for giving both of yourselves and of your time, taking time away from your families and from your life, to be here with us in the hospital or the community setting, to just provide us with this incredible experience.
Thank you for everything you taught me. You really brought to life all the things I learned in the classroom, all those pieces of knowledge and skills that we learned in school. You brought it to the real world for me and taught me how to apply it and how to just be compassionate and caring as a nurse. Thank you so much.